Okay, two chest x-rays in front of you again. The one on your left hand is normal despite of this normal variant which is known as aortic nipple. The one on your right hand side has an interesting finding, and I want you to look at the retrocardiac area of this x-ray and note that there is no abnormal density or opacity, and also note the position of this gastric bubble just underneath the left hemidiaphragm. On this x-ray you see a very obvious and distinct opacity with a sharp outline projecting over the left ventricle, and if you look closely, there is a round or barrel shaped opacity right in the midline above the diaphragm as well. Such opacities do not exist on normal chest x-ray. So what do you think that is? If you thought it was an abnormal mass, tumor of some kind, or it was dilated aorta, you would be wrong. Frequently left ventricular aneurysm has similar appearance, if not exactly the same. But if you look closely, you can easily find the correct answer. The biggest clue here is this air density projecting in the retrocardiac area above the left hemidiaphragm. Although you can see some air in the transverse colon and in the descending colon as well, the gastric air bubble is missing from this x-ray. Well, in fact, the gastric air bubble is just seen here in the thoracic cavity just above the medial part of the left hemidiaphragm. This indicates that part of the stomach is in the thoracic cavity. This is a typical picture of hiatus hernia. The word hiatus means break in continuity, and the word hernia is a condition in which part of an organ is displaced and protrudes into another cavity. In this particular case, part of the stomach is herniated into the thoracic cavity. This finding is not very uncommon in clinical settings, and if you belong to health industry and are responsible to make diagnosis, then you should know what hiatus hernia looks like on a chest x-ray. Previously it was believed that it was caused by congenital shortening of esophagus, but we now know that this is not true. It is now believed to be a result of combination of increased intra-abdominal pressure, mostly due to obesity and diaphragmatic weakness. Unhealthy processed food and Western style diet is to be blamed. The major implication is the reflux esophagitis, which is because of malfunction of lower esophageal sphincter. One can also develop stricture because of acid reflux, and many believe, and there is scientific evidence, that it can cause esophageal cancer in long run. Thank you very much.